look at it good?
Yes, there we are, Doc.
So look at this X-ray with your camera. So if you look at this X-ray, you see that there's this is a joint that you're hyperextending, which is this joint right here.
Right.
So the joint below it is called the CMC joint. That's this joint right here on the X-ray.
Okay.
And if you look at that joint looks like it's a little bit slipped out by about 40% of its diameter. And if you look at this X-ray here, you see there's severe arthritis in there. The bone is completely unboned, rubbing on bone. So that would be causing pain in this area of the thumb. You're not complaining of any pain in that area of the thumb right now, so I'm going to kind of ignore this for now, cover it up.
Okay.
We're going to deal with this. Now the joint there, it looks pretty good, but the reason why you're hyperextending your joint to be comfortable for guitar is because of this thing here. It's kind of a complicated how these two interact with each other.
Yeah.
When you have arthritis at this joint, your thumb shortens a little bit, and then it causes hyperextension of this joint. And then you also have arthritis going on at the last joint here, called the IP joint.
Yeah.
And there's a little bone spur right there that you can see, and that bone spur is a sign that there is arthritis in not just the base of your thumb, but also in the end of your thumb.
Oh.
The middle joint where you're hyperextending might be arthritic. It's hard to say by this X-ray. The bone surface looks okay. There's enough gap in here.
Yeah.
And certainly, I want to look at this. And look at this view over here. It looks perfect. It looks like there's no loss
bone
of joint
bone.
space. It's all there's a nice gap in there which is full of cartilage.
That's good.
Unlike this joint here, down here, which is completely gone.
Oh, it's
And then this
fused
joint's
into the other.
not quite fused, but it's
Up
it's
against
bone on
it.
bone. There's movement there. It's not fused, but it
Yeah.
causes pain. Here, you still have gap, which is the next joint down,
Right.
and that's fine. So it's only in some of the joints, not all
So
the joints.
that's the culprit right there, huh?
Okay. So now turn around, show me, see me in there. So the treatment for your thumb, first of all, is going to be to give you a cortisone shot into the area where the triggering is happening, so you can straighten the thumb all the way and bend it all the way, and so it won't click anymore. The cortisone shot is effective in about 70% of people and cures it, and the other 30%, it may temporarily fix it, and then it may come back. If it comes back, it's still clicking again, and that's what's bothering you, then we can do a procedure in the office where we just make a tiny incision in the skin and use the ultrasound to look where the tool is going. We can open up the tight tunnel that's causing the triggering, and that has a 95% success rate. Maybe
95% success rate?
Yeah.
So there's hope.
Oh yeah. But I'm just telling you that your trigger thumb is what brought you to see me today, but that's not the end of your problems. That's just the beginning of it. You got other problems in your thumb that is not bothering you yet, so we're not going to go after it. But in the future, if you start having pain at the base of your thumb, which is right here, especially when you're pinching something like
Yes.
a jar,
Yes.
then we may have to deal with that as well. We have to give you a shot into that joint to try to get that under control. So we'll cross that bridge when we get to it.
Okay. What I wanted to ask you is when I do put the duct tape on my hand, does it create more of a damage?
No, not really. If that helps you, do it. It kind of immobilizes it in a position that is functional for you.
Yeah.
So it's okay to do that if you want.
'Cause I manage my pains by changing my habits.
Yeah. Right.
You know, I'm lifting with my right instead of my left and stuff like that.
Yeah.
So, all right, well,
So you're okay with that? You can stop
yeah,
it
thank
for
you.
now.
Thank you very much, Doc.
Well, you want to do the shot today?